So there's a child who's 4 years old and who's eyeing a red toy, a shiny car, and he really wants it when he has plenty in the house. So his mom says, no, I cannot buy you this today. And before she knows it, he's on the floor, throwing a tantrum, throwing stuff around. The mother is really embarrassed about it and she doesn't know what to do.
Sometimes children are very fixated on one specific thing that they want, in like milk in a specific cup. The younger child wants what the older child has, just that specific cup. How do parents really deal with those sort of situations at home?
You go to the root cause and you deal with it from there. It's not just about the cup at all. It's about what the child is feeling.
And the parents who are trying to make a difference, trying to make the change, when there are other people saying, you know, that is how it was.
Yeah.
What are you doing something different? Things like that, you know, gives you a setback.
See, first of all, we have to understand that anger is a normal emotion. That becomes a problem is when it is persistent. You know, the child is getting agitated and irritated for absolutely no reason, for things that you would think is very trivial. Screen time is playing a big role in it. Number one, it's giving them that dopamine hit that they want. Violence has become such a normal thing in the movies right now.
So forget movies, even in
cartoons. Yeah.
Sheriff Labrador,
yeah,
constantly change.
Yeah.
Peppa Pig has a new Peppa Pig EXE, which is the scariest things.
Yeah.
So how as a parent can we develop an awareness of how to deal with an angry child or a child who's having those big emotional feelings, you know, happening at that moment?
Welcome to another episode of Kupshup,
Keeping Up with Parenting.
I'm your host Vinodini.
And I'm Kavita.
And today we are going to talk about a topic that all of us parents encounter: anger in children and teenagers. From toddler tantrums all the way to teenage outbursts, anger looks so different in every stage. But what is really happening in that child's brain when they get angry? How can we as parents support them emotionally while they are going through all of these big emotions? To help us unpack this very heavy topic, we have with us our very special guest, Dr. Kaveri Subbaih. Dr. Kaveri Subbaih is a developmental and behavioral pediatrician and the director and clinical head of Vistala Child Development Center from Keel Park. She has worked extensively with children and families to navigate these big feelings in little hearts. Welcome, Dr. Kaveri. Thank you so much for joining us today.
Thank you so much for having me. I'm really looking forward to this conversation.
Let's dive into this conversation with a very simple scenario that most parents encounter in a toy store. So there's a child who's 4 years old and who's eyeing a red toy, a shiny car, and he really wants it when he has plenty in the house. So his mom says, no, I cannot buy you this today. And before she knows it, he's on the floor, throwing a tantrum, kicking his legs and throwing stuff around. And people are looking. The mother is really embarrassed about it and she doesn't know what to do. And she tries talking to him, doesn't work, yells at him, doesn't work. In fact, it kind of aggravates the situation. Yeah. So what do you think is happening in the child's brain at that moment? Yeah. Is that kind of a frustration and anger in a child that young? Is it good?
See, we have to understand that this is a common scenario and it is a very, very normal reaction. The child's brain is not fully developed yet. Especially the prefrontal cortex, which is responsible for impulse control, is not fully developed. In fact, well into the 20s is when it gets developed. It's, you know, it's very, very immature right now. And the amygdala, or the part of the limbic system, which is responsible for the fight or flight response and emotional regulation, is on an overdrive. So their emotions are at a peak, but there's nothing to control the emotions. There is no impulse control at all. So this is a normal developmental milestone for a child. Tantrums are very normal. So it is a reaction that's going to make a big difference. So you understand that it is normal. You let the child cry it out through a tantrum. You calm down yourself first. And then you sit next to the child. You don't have to tell them that it is not okay, but you tell them that I'm here for you. And I understand that it is difficult for you, but that does not mean that we can get this car. You know, we can do this some other day, but today is not the day for this. And you sit with them and comfort them. All they need at that point is comfort. So to answer your question, yes, this is very normal.
You know, that is one form of anger that we spoke about. Yeah. But there are so many different forms of anger. Like she said, there are toddler tantrums. Some children just withdraw and keep to themselves.
Yeah.
Some become very passive aggressive. So there are so many forms of anger. What are these different types of anger? How do parents really handle those different types of anger?
Okay. Yeah, there are different types of anger. Like there is this explosive type of anger where they're throwing tantrums, and there's this withdrawn type of anger where the child is like, just building up resentment and, they don't want to express the anger itself. There's this passive aggressive type of anger where they will resist everything, but they don't want to openly say it. And so these are few of the different types of anger. But how it is different is, I think it depends on the child's personality and also how we have reacted to it. If a child believes that expressing anger is wrong, or if that's what they've been taught, they are going to get passive aggressive. They're not going to openly express it. And also the age of the child matters. A younger child, a toddler, would throw a tantrum. A little older child who understands that throwing tantrum is not acceptable would go into this passive aggressive mode. And an even older child might even build resentment.
Right.
So all of that, these are the different types of anger that you see.
Important. Having said that, right, you've answered a lot of our questions that we had on this topic. Sometimes children are very fixated on one specific thing that they want, and like milk in a specific cup. The younger child wants what the older child has, just that specific cup. How do parents really deal with those sort of situations at home when they're just throwing a tantrum about something very particular that they want and they can't have it because somebody else is already using it?
Yeah. See, this, we again have to look at the underlying cause. Is it just the cup, or have there been other triggers leading to this? See, some days the child is okay with drinking from any cup.
Yeah.
But some days the child is fixated on certain things. So why is this happening? So is the child hungry? What are the triggers? Is the child exhausted? Is the child very tired? Or is the child feeling like he's being treated very unfairly? The sibling is getting the better cup or whatever. So you go to the root cause and you deal with it from there. It's not just about the cup at all. It's about what the child is feeling. And this is a great opportunity for you to connect with your child. You sit down with them and have a conversation with them. Like, why are you feeling this way? Are you hungry? Do you want to eat? Is it really about the cup? And you would be surprised about how much they will actually open up to you after you have that conversation. So I think that is the way to deal with it.
But the thing is, as parents, as adults, sometimes we don't even know. We have not been taught to handle a child like that.
Yeah.
We have seen our parents either give us a slap, or just yell at us and ask us to stop the behavior, or just not give in.
Yeah.
So that is the kind of parenting we are used to.
Yeah.
So how, as a parent, can we develop an awareness of how to deal with an angry child or a child who's having those big emotional feelings, happening at that moment?
Yeah.
Because our tendency to get angry back at them.
Yeah. So we think getting angry back at them is very normal because that's what we've been exposed to. But I always tell my patients also, put yourself in their position. Go back to when you were 10 or 7. Or would you have wanted your parent to react this way? So if you are not comfortable with that, do not do it. When you think about it yourself in that way, you wouldn't do it. You are not happy with somebody coming and yelling at you for absolutely no reason for something that's very trivial, like a cup. But we think it's okay because they're not, retaliating. So I find that most of it comes down to the parents, and the children just mirror your behavior. If you model anger and if you model aggression, they're going to mirror it because they think it's okay to, be angry and be aggressive. So all of this comes down to your behavior and how you are expressing your anger.
How does, when do you see the kind of anger we're used to? As young as a 10-month-old baby or a 1-year baby, or is it forming around 2 years, 3 years? When do you see it?
It's usually around 2 years.
2 years.
2 years. And it's especially, you see it more in children who cannot express themselves too well. So I think you need to equip your children with the kind of vocabulary that they should be having. If there is a speech delay, you will find the child to be more aggressive than other kids because they do not know how to express themselves. So you go to the root cause. You correct the speech delay. You do not correct the aggression. So when you correct the speech delay and you give them the vocabulary, you will see that the aggression comes down.
So how do you correct that speech delay?
Yeah. So when you find that there is a lag or a delay in our country, especially, you will hear parents and grandparents saying, even he spoke quite late. So it is, just wait for it to kick in. Yeah. But that is not how it works. You approach a professional. In this case, you can go to a developmental pediatrician and they will do an assessment and let them tell you if it's normal or abnormal. If it's normal, then good, you just go back home. Yeah. Then if it's abnormal, there are like very minor interventions that you can do when they come to you as young as 2 years old. And then they're completely normal when they're around 4 or 5. But when we delay this, it's just going to get worse.
But how long do we wait? I mean, is there a yardstick, like if they don't start talking by 2 or by 3, how long do we wait?
Around 2 years of age, the child should be able to combine 2 words and talk to you. You know, at least say, Amma, water, or come here. Or they should be able to, their vocabulary should be at least around 50 words. So when you see that all of this is not happening, or it's okay even if this is not there, but when you notice that they're not even attempting to converse, or if they're not even coming and communicating their needs to you, then that is a red flag.
What are some of the, so speaking of red flags, right, the parents should look for? Because anger, like you said, is only a manifestation, it is only a symptom. There is definitely underlying issues, right? Some of the times. So what are some, when it comes to a child being very, very angry, right, what are some underlying issues that we need to look out for in parents? For younger children, you spoke about speech delay, but for other older children, would it be low self-esteem, self-confidence? What are those red flags that we should look out for?
See, red flags in anger. See, first of all, we have to understand that anger is a normal emotion and it's okay. But when that becomes a problem is when it is persistent. And, you know, the child is getting agitated and irritated for absolutely no reason, for things that you would think is very trivial.
Right.
Yeah. And then it's lasting for a longer period. Like if you see a tantrum, it'll last for about maybe 20 minutes and then the child just calms down after that. But if that isn't happening, then you have to think about why this is not happening. And that is when you reach out to a professional. Or if the child is harming themselves or other people, like, you know, they're kind of a threat to the society, then it's definitely a red flag.
And there is, again, going back to the types of anger, right? There are, in my head, I'm going to just divide it into two. One is a very reactive anger based on the situation. This child says, I want the look up, can't get, I'm going to get angry about it, fight with you. The other anger is one sort of cold, simmering anger. That comes up from nowhere. You would have said something a year ago, 7 months ago, and suddenly that will come out of no context at all. Out of context, it will come up saying, but that day, you said this about me. How do you, as a parent, right? We all slip up. We've all done this, said something in a burst of anger, fit of anger again. How do you handle it when a child, when both of these instances, both situational anger and
a simmering kind of anger. See, I think this reactive anger you would see more in younger children, and then after that they're completely fine. But when the simmering anger happens, we have to think about why this child is behaving like this. Are their emotional needs being met? Are we spending enough time with the child? Because attention is one thing that will actually bring all of these problems down. If you find that the child is not getting enough attention from the parents, this is their way of expressing it, their disappointment. And in today's day and age where everybody is running, I do not find parents spend a lot of quality time with the child. By quality time, I do not mean the time that where you're like, you know, grooming them or, you know, feeding them. That does not come under quality time at all. Around 30 to 60 minutes every day, you just sit and do something with them. You develop a family hobby. You play a sport with them. Sit and play board games with them. At least 1 hour of that every day will make it so much easier for the child to connect with you. Even if there's a problem, the child will not hesitate to come and tell you. So I think this is the reason for simmering anger.
Got it. No, and that's very true. With our busy days and lives, we don't get the time to do anything, right? Except the basic necessities.
So we're talking about the underlying anger, reactive anger and simmering anger. What if the child is cognitively well developed, has the necessary verbal skills to talk about his or her emotions and feelings, but in the heat of the moment, he or she tends to get angry for no reason at all, or bites or pushes or scratches, but then also defends his or her action. Where is that coming from, and what do you do to deal with such kind of an anger?
Again, with this child also, check if their emotional needs are being met, their physical needs are being met, and everything checks out, everything is perfect. we can look into other medical conditions, like even something as simple as an iron deficiency can cause the child to be very irritable. So just check your iron levels, and that's you can correct it with pills. It's as simple as that. Or even thyroid levels. If it's a little excessive, it's in hyperthyroid case, the child can be very restless and irritable. And also like other neurodevelopmental disorders like ADHD, there are 3 components to ADHD: hyperactive impulsivity and inattentiveness. We always associate ADHD with hyperactivity, but there are cases where children predominantly present with impulsivity and inattentiveness. So it could be one of those cases. Or even if there is a sensory issue, like a sensory processing disorder, these kids get overstimulated with normal, it could be the sound of a mixer, grinder, or something like that. Even that can overstimulate them. So we go to the root again and then correct it from there. If you find that everything else is normal, it could be one of these things.
So where do they go? Will a pediatrician be able to help them, or?
You can definitely go to a developmental pediatrician and then they will guide you from there.
So when we talk about anger as an emotion, no, it is just an emotion. It is an emotion like being excited. Some kids, you don't know how to control their excitement. They can get overexcited. Anger is also, while we see that in a very positive light, anger is unfortunately branded to be negative, right? Which it is not. But kids also need to learn to regulate themselves. All the calming techniques that you have mentioned previously are things that parents can do to help their children. But what are some calming techniques that parents can equip their children with? How do you teach your child to manage your anger? These days, I feel there are adults who don't
know how to manage. That is the problem, because number one, you model it. When the child sees you angry and the child realizes that you're just calming yourself down, either by taking deep breaths or just sitting in a corner, the child knows that that is the way you react to an anger. So you teach them, tell them, take deep breaths every time that you're angry, or count down from 5 to 1. Or if none of these things work, there is also something called time-in. Initially, we used to call this time out, but then we associate that itself with so much shamefulness, because you're letting the child go to a corner, and that is not a very nice thing to do. So you sit down with the child and you talk to the child about what has happened, and you have a discussion with them, and then you find some middle ground. You can do that. Well, there is this beautiful technique called token economy. So what we do in this is you buy like a piggy bank or something and give them, you have some tokens. And every time a child does something right, you add tokens to it. And every time a child does something wrong, it could be aggression, anger, whatever, you take away the tokens from that. And then you hold that boundary and you tell them, when we reach about 10 or 20 tokens, we can go get something that you like. So the child is motivated to behave well, and also they realize that when they do something wrong, that it's going to be taken away, and it's going to take a longer time for them to achieve that. So this actually has helped modify so many behaviors that have been troublesome.
I have seen this being used in a lot of different ways, and I've always had a question about it. We've seen the token system being used in so many different ways, right? But when a child is trained to this token system, will they associate behaving well, not acting out of anger, only with gratification, and sort of start looking for what is in it for them? Or how do you wean it off as well? Because
see, this is for very young children. You do not do it for an older child. They're not even going to respond to this. But if you want to modify a behavior, this works very well. But they should also know that the love from the parents is unconditional. That is not dependent on this token economy. This is just for a toy or something that they're working towards, not for the love that the child, that the parents show, or the trust parents have on the children. So they only associate some sort of small, trivial things with the token method, and not like bigger feelings with that. And as they grow up, you stop doing this and you move on to other methods.
So what are the other methods for older children?
Older children's usually just, CBT, like you do something called cognitive behavioral therapy. I don't know if we should be talking about it here.
Okay, but other than that, any simple techniques?
Simple techniques, you just sit and talk to them about it, and you would say spend more time with them. It's like a repetition of set boundaries, all of that.
So there is another kind of anger, right?
Yeah.
Kind of simmering anger probably fits in there.
Yeah.
between siblings. So when a new sibling enters their life, their entire life is topsy-turvy now. And they feel that the attention has gone to the newborn. And sometimes they react, so you know where it's coming from. Sometimes they let it simmer. So you're thinking everything on the surface is good, but at some places, somewhere, a random outburst happens. If this is unchecked, they could very well carry this into their adulthood.
Correct.
And probably later, when they're seeking therapy or when they're aware of it and they're trying to change, they might take it back to this particular period when they felt their parents were not emotionally available. So what steps should parents who are welcoming a second or a third child, what should they be doing to make sure this doesn't happen to their child, and how to sustain it for a longer period? Because initial few months or a year, you can. But then it doesn't stop there. As the newborn grows into his own personality, the anger takes different forms. Now you're comparing, you're not buying the same thing. So it differs at each stage. So how do we tackle it at each stage?
So first, we need to acknowledge that this is a problem and it's going to be very difficult for the first child. We cannot just brush it under the carpet and act like it's absolutely normal. The first child has been their world for however long, and suddenly there's this new creature that's come into their life and they're like, no, like that tension is gone to him. So you accept and acknowledge it. You make sure you're getting one-on-one time with the older child also, both the parents, not just the father, even the mother. When the baby is asleep or done with feeding, you make sure you get at least 1 hour, half an hour with the older child, where you're doing something that the child enjoys. And then number 2, you can involve the child in the activity. Like if, for example, if you're going to like bathe the second child, ask him to go get the whatever towel or whatever. So involve him in those chores also. So he feels like he's also part of it and he's not like left alone. So these are some of the things that you should be conscious about. The second child comes into your life. So instead of just ignoring it completely, please be aware of it and make sure the child gets the attention that they deserve.
Okay, so having done all that, when you suddenly see an outburst, will you be able to connect it back that it's because of an entry of another child into the family?
This will not happen immediately, but this is, instead of the word gentle parenting, no, I really want to ban that word and change it into conscious parenting. Right? So be conscious about what is happening. If you see an outburst and you know that there's a new child, new baby that's come into your life, you have to make that connection, because the child does not know how to verbalize it yet. He doesn't even know why he's feeling that way. But we, us being the adults, we need to make the connection. So I think that should be done.
You know what? On this topic itself, right? It does not always manifest as an outburst. It manifests as harming the second born. A little bit. Pinches here, which is only a pinch if it's a slightly older baby, but for a newborn, or even a pinch is too much. Right? Or pulling his hair, or slightly pushing him, trying to push those boundaries along with the baby. Right? How do you deal with this? Because this is dangerous. We also get angry.
The worst thing that you can do is yell at the child at that point. And you getting agitated. So what the child feels is that they like the second one more than me. That's exactly what they're going to think of it. So what you should do is take the child aside, sit down with the child, and have a conversation with them and tell them that I love you no matter what. Both of you are equal to me, and make sure it's just reassuring them more than anything. It may seem like a very simple step, but that goes a long way. Take them out, and then you say, do something that they really enjoy doing. Take them out and just mommy and the child or the daddy, like have daddy-daughter dates or whatever, and plan like all these things. So they get excited about it. Have like a movie night just with the child, with the 4 of you. Doing these things and taking that extra effort will definitely go a long way.
And I honestly think that this is where both the parents contributing equally will
100%.
Right? If there is one parent who is not as much, and no specifying genders here, right? But if you can contribute as well as much as the other parent, I think it will do wonders for the mental health of the older
child, definitely.
Take turns in doing it. So An interesting new thing that's happening is associating screen time with anger. A child is fine all day long. Evening waiting, ayyo paam, okay, half an hour TV போட்டு விடலாம். But when you say, hey, half an hour's up, time to switch off the TV, there is one flip in that child. The child who's being wonderful the whole day suddenly flips and says, no, I want to watch this.
Yeah.
Do you see children like that?
Yes,
How do we...
that is why there is such an increase in these anger outbursts now. Screen time is playing a big role in it. Number one, it's giving them that dopamine hit that they want. It's like happens over a very, very short span of time. So they really like it. And switching it off immediately is like, just trying to stop all the dopamine that's coming in. And then they really do not like it. And they throw a tantrum and all of that. The best thing that you can do is not introduce screen. I mean, by not introducing screen, when you're around them, you also do not watch anything around them.
That's a very difficult thing to do.
It's a very difficult thing to do. But if it's absolutely necessary, then you have to do it. But you can't be mindlessly scrolling when, your child is there, because all they want is your attention. That is just, I feel this, if you switch off screen, you will get a lot more time with your child. We always think that we don't have time, we don't have enough time with the child. But if you think this mindless scrolling takes about, at least half the day. Even if you're at work, you're scrolling. At home, you're scrolling. And the child has nothing else to do. They're obviously going to switch on the TV and watch something. So we have to model what you're expecting from the child. I think once that happens, it'll definitely...
But if screen time is introduced, after I think 5-6 years, screen time naturally gets introduced.
Yeah.
How do you set those boundaries so they don't react with anger immediately?
So you prepare them. You tell them, okay, you can watch for about half an hour. And you have control over what they're watching. And do not give them phones. There's no personal screens at all till they're well into their teenage.
I agree.
Yeah. Then whatever they're watching should be on the TV in the common room, where everybody is around. So you have control over what they're watching, because it's very scary what they can get exposed to. And violence has become such a normal thing in the movies right now. Even if you rate the movie like an adult movie, you see children walking into the movie theater. Nobody is stopping them.
So, forget movies, even in
cartoons. Yeah.
Sheriff Labrador, they're constantly changing.
Yeah.
Peppa Pig has a new Peppa Pig EXE, which is the scariest things.
Yeah.
Violence has become normal.
It's become very normal. So the children obviously think that it's okay to behave that way. So be very conscious. Even if you want to show them something, I would prefer something like Bluey to, a Peppa Pig. Or, there are some cartoons that you can show the children when they get older. So you should have control over what they watch.
I agree. So as a pediatrician as well, right? Big emotions like anger. Does food or a diet like an excess of sugar, any of that, does it have an impact on their emotions? Or
definitely excessive sugar, all these items with coloring agents.
Right.
So all of this can have an impact. And even talking about screen time, I should also mention that screen time post 6 o'clock in the evening has a terrible effect on their sleep, because the melatonin is the sleep hormone.
Right.
It gets confused because there's so much light coming in, and then it does not know if it's the night or the day. So it kind of messes up your circadian rhythm. So the child is not able to sleep through the night, which is making them more irritable through the day. And you're having outbursts of anger.
So it's a cycle.
It's a cycle. It's a vicious cycle that we have to stop. We have to put a stop.
But the thing is, with so many people, caregivers around, oru chocolate thane, oru 10 minutes thane, idu kudta enna.
See, you have to set that boundary with them also, in a very kind but firm way.
Or, tata kuda abdidan coach par, he'll bang the door like that. It's in the gene.
That's very valid.
Yeah, it is not in the gene. I mean, maybe it is in the gene for a major outburst or a major...
Is the gene even anger?
No, it can be in the gene. I mean, not just an emotion, but the personality trait itself can be
so that is something that's carried through.
But for them, nobody's managed it properly. But now with the equipments that we're having, we can beautifully manage all these things.
Right. So accepting and saying, I think that's another topic that we will have to have, saying grandmothers or grandparents or just other people normalizing things that can very well be corrected.
Yes. Yeah. And the parents who are trying to make a difference, trying to make the change, when there are other people saying, that is how it was.
Yeah.
What are you doing something different? Naangala valaraliya, ongala valakalaya, things like that, gives you a setback. You're like, okay, fine. I'm trying to do something different with my child.
Yeah.
But it's not being accepted so socially.
Yeah.
I think that forget socially, consensus within the
Family itself is a problem.
so important. How do you so I'm sure you would have had people come to you with the mother saying one thing, maybe father saying something else, or grandparents really resisting whatever you are asking them to do. What are your thoughts on just that situation?
This is so common. Every single patient that walks into the clinic tells me that, we are trying to do all of these things, but the grandparents, we have to leave the children with the grandparents because they go to work, and this is what happens. So how do I deal with it? This is a very sensitive topic also, because there is no other way but to set a boundary. Like, you set a boundary, but in a very kind and firm way, so it does not sour the relationship. You tell them that the world that we grew up in is so different compared to the world that these kids are growing up in. We did not have screens back then. We did not have so many of these things that they're getting exposed to back then. So it is definitely a different world, and the upbringing cannot be the same. And the reason it worked also, I don't know if it was the right way to raise children. We did most of the things out of fear. So because these children right now do not feel that kind of fear that we had, they are not hesitant to express themselves. So that does not mean that it is a bad thing.
But somewhere I feel, right, that a little bit of, I wouldn't say fear, but discipline or fear of your work, somewhere that should be instilled. As a conscious parent, how do you instill that without really causing like fear of hurt or fear of harm?
Yeah.
We do it.
See, natural consequences, let them face it. If they don't want to do homework for, whatever, let them not do the homework. Let them go to school without doing the homework. Then they're going to face it. Let them face it and come back. And then the next time they will sit and do it. It's us we're actually stopping them from doing it because we are so scared for them.
Yeah, we are very protective of our children. We don't want them to face any form of rejections, failure, everything that they will face all through their lives. We try to cocoon them from it.
So we've been talking about anger in toddlers and younger children.
Yeah.
How does anger manifest in teenagers, and what are the coping strategies for them as well as for us, so it doesn't get into a battle every day in the house?
Yeah.
It's a power struggle.
Yeah. It is.
It's completely different when it comes to teenagers. Your approach itself has to be different because, you can't shoo them away, because anything that you do can put them into a shell. So with teenagers, you should also understand that they're going through a lot of changes, both physically and emotionally. There's a sudden surge of estrogen and testosterone, and, their brain is developing at a rapid pace. So, but still their prefrontal cortex is not fully mature. So they do not have the impulse control. So it is a really bad combination of different things. First, you sit and talk to them about the changes that they're having, and you tell them that it is normal, because that itself is making them feel very anxious. And every time you see them, getting passive aggressive, because teenagers, that's what they're going to be. They're going to be passive aggressive and all of that. You validate their feelings. You cannot just tell them, this is such a small thing, why are you reacting like this? Or you talk to them about it and validate it. You say, I understand what you're going through and it must be very difficult for you. So shall we talk about it? And then you develop some bonding techniques, you do a family badminton every week, or some sport that you pick up. So all of this turns into a time to bond with the child, so where they're not reluctant to come and open up to you about whatever they're going through.
So I have a question for you about teenagers. What you spoke about, their bodies changing at a very fast rate, hormone surges. What age does it start at? Sometimes all these behaviors kick in at 9 years.
Yeah.
You're not even thinking of them as teenagers at that age.
It can start as early as 9 years, 8 years even. So you kind of prepare your child for everything that they have to face. You tell them earlier itself that these are going to happen, and all of these changes are very normal, that they can come and talk to you whenever they want, and that you're always available for them.
When does it when does their body calm down? from all of these processes?
This will take at least another 5 to 8 years for them to calm down. So it is a very turbulent time, not just for them, even for the parents. Because, till then the child would have been a perfect, sweet little angel suddenly turning into this teenager.
Right.
It is very scary for the parent. But again, you understand that it is a very normal part of development. I think you just bond with the child, validate their feelings, and accept that what they're going through is very difficult. And also the academic stress is also increasing.
Right.
And one more thing that I wanted to mention was that when these children have outbursts, it could also be because of some academic strain that they're facing. There could be a minor learning disability that we always kind of miss.
Right.
Because, you think the child is just not able to study, but there could be something underlying.
Yeah.
And that comes out as anger again. And these things tend to come around the teenage years.
Oh, wow. So when they're already going through so much physically, mentally, and added underlying issue like this that was unnoticed for so long, it can be a huge strain. So I actually have a scenario for this.
Yeah.
There was a child who was very good with whatever she was doing in school, everything. And I think around her early teens is when some sort of shaming by the teacher happened at school for something silly. The child got so angry that she refused to go to school after. And it just became whatever started as a very small thing. Evlo titro nama veetla pasakla or school when they're younger. This one issue just stood out so much. And for a few months, she refused to go to school, and it became a huge battle for the parents. What do you have to say to some of these issues that are more commonly occurring now?
Yeah. See, these things we should also understand that things like anxiety and depression is not only seen in adults, it's also seen in children. If something as severe as, refusing to go to school can happen, we have to look into such things also and see if there's an underlying anxiety disorder that the child is facing. It just cannot be one incident. It is definitely so many things that has triggered this response.
Got it. So, coming back to our original topic, right? Anger. Are anger, anxiety, depression, are they all even related, or are they completely separate? It doesn't...
I don't think we should mix up anger and anxiety. Anger is a normal, like everything, these are all normal emotions, but it can turn abnormal when it is in excess. But anger can be a part of anxiety, as in it can be a sort of manifestation of underlying anxiety or a depressive disorder. But anger can also be a very normal emotion. It depends on how severe it is.
Got it. That's a good point. Anger is a very, very normal emotion that we all face. And one very sort of preventive methodology that you've spoken over and over again is about bonding,
Connection.
building that connection right from the start and the difference that it makes. Do you have any examples of how building a connection and building a sort of a relationship or understanding with the child's point of view, has that changed anything? Do you have any examples?
I have seen so many children who come to me with kind of aggression and, even very severe aggression where they're like biting other children. And I've told them simple tips like, just spend time with your child, like 1 hour every day. And I've seen it come down so much in the next 1 or 2 months.
Oh, wow.
Just by spending
time with them. Because, we think we're spending time with them, but it is a very half-hearted kind of time that you're spending with them because you're always on your phone. You're doing something on the phone and then you're just saying yes. But when you put that away and then you sit with them and talk to them, they actually open up to you and they calm down so much, especially younger kids. That's all they want. If you feel like your child has had a bad day, you go back and see how much time you've spent with them. That would be a bad day. If it's very less, that would be a bad day for your child. If the child has had a good day, it'll mostly be on a Sunday because you have spent more time with the child. The child would be better behaved than other days. So I think this should be an opportunity for you to connect with your child. If your child is having outbursts, it means it's just a cry for help. It is a cry for connection. So I think that is what we should take away from this.
Okay. So does that translate to school also? Like if you're seeing that kind of a biting behavior in school or...
Yeah, it can.
Okay. So it could be because of lack of sleep, the kind of food they eat?
Yes, it could be all of these things put together. It could be one thing that is a little excessive. So I think it comes down to these factors that we've spoken about today.
Thank you so much, Dr. Kaveri, for your time. I think Everything that you've spoken about has been so insightful for us. And viewers, if you are looking at this podcast and the next time you see your child getting angry, just take a minute to look into their eyes, talk to them, understand what's really going on and build that connection. And if you know of anybody having a little child, please share, do subscribe to our channel, and thank you so much for watching. Thank you very, very much.
Thank you, Kaveri.
Thank you for your time.
Thank you so much. I had a wonderful time.